first contingent of Australian health workers helping to tackle Ebola in an Australian government-funded treatment centre will depart for West Africa this afternoon. The initial deployment of 17 Australians comprises 6 doctors, 8 nurses and 3 environmental health officers. They'll work alongside about 200 staff in the British-built facility in Sierra Leone.
The Australian government has provided $42 million in total for our response to the Ebola outbreak in West Africa, and today 17 Australian health workers, doctors and nurses and other environmental health workers will be leaving for West Africa. We wanted to make sure that we had in place appropriate guarantees and support for any Australian health workers going to West Africa. We have committed to fund and support a 100-bed facility in Sierra Leone.
The opposition has welcomed the move but says the deployment is overdue.
We are pleased that the federal government is finally providing assistance in terms of tackling the deadly disease of Ebola in West Africa. For too many months, the federal government pretended this wasn't their problem. The rest of the world, France, England, the United States, China, were all moving to tackle this deadly disease a lot earlier. Belatedly, the federal government's coming to the party because they realise that they've pulled the wrong foreign policy decisions. But we are pleased, and I commend the volunteers and I commend the people who are going there,